Did you know that having had a cesarean section with a previous pregnancy doesn't necessarily mean that you need a repeat cesarean with each subsequent pregnancy? I personally fought tooth and nail during my second pregnancy to TOLAC, which means trial of labor after cesarean, which resulted in a successful VBAC, which is a vaginal birth after cesarean, with a 9.5-pound baby in September of 2019. Any birthing person still has several different options for birthing after having had a C-section. During the next few minutes, I will be discussing those options, such as planned cesarean, TOLAC, emergency cesarean, VBAC, and HBAC, which is a home birth after cesarean. First, let us begin with the planned cesarean. According to the Johns Hopkins Medicine article titled Cesarean section, C-section, or cesarean birth is a surgical delivery of a baby through a cut or incision made in the mother's abdomen and uterus. Providers typically suggest cesarean births when there are risks to mother and baby associated with the vaginal birth. The incisions can be vertical or the more common horizontal. The type of incision is dependent on how mother and baby are doing. An article published in Women's Health titled Risks and Morbidity Associated with Previous Cesarean Section states, repeat elective cesarean birth is associated with an increased risk of complications such as bleeding, the need for blood transfusion, infection, damage to the bladder and bowel, and deep vein thrombosis. As the number of cesarean births for each individual woman increases, so does the difficulty in performing surgery due to adhesions and the risk of damage to the bladder and bowel at the time of surgery. This article goes on to list difficulties in conceiving a further pregnancy or developing issues with the placenta. Now looking at the benefits of a repeat cesarean, we turn to an article posted on uptodate.com titled Choosing the Route of Delivery After Cesarean Birth, which states, in a hypothetical group of 100,000 patients of any gestational age who undergo a planned C-section, there will be 26 uterine ruptures. Now this compares to the statistic in the same article of uterine ruptures occurring in TOLAC patients, which is 468 out of 100,000. Also, from hearing the experience of multiple mothers who have chosen a planned cesarean after one prior, one major benefit includes the convenience of knowing when your baby will be born, especially since you will have another child that will need to be taken care of during your hospital stay. Now, since we've covered planned cesareans, let's consider the opposite. The option I'll now cover is the TOLAC, which can either result in a successful VBAC or an emergency cesarean. According to an article published by the University of Chicago, trial of labor after cesarean, which is TOLAC, is a planned or attempted vaginal birth after cesarean, VBAC. Sometimes there is a need to change the plan, and a TOLAC results in a cesarean birth after cesarean. A birth is officially considered a VBAC once the TOLAC results in a vaginal delivery. This article goes on to state that the benefits of a VBAC are significant when compared to a repeat cesarean, and lists a few. This list contains delivery without abdominal surgery, quicker recovery and healing, reduced risk of infection, reduced blood loss, reduced risk of hysterectomy, bowel or bladder injury, placental disorders, and other complications associated with multiple C-sections. As I stated earlier, the up-to-date article by Tori D. Metz, TOLAC is associated with a higher risk of uterine rupture. Uterine rupture poses the risks of hysterectomy, which can be from 14 to 33%, and perinatal death, which is 0 to 28%. I also had the pleasure of interviewing a fellow VBAC mom, Vanessa Martin. When I asked her why she had her initial cesarean, she stated, I had my initial C-section because it was medically necessary at the time. My son's heart rate had dropped, and I was having an allergic reaction to Lasix. I believe it could have been prevented had I not been induced after my water broke naturally. She went on to say that she indeed had a successful VBAC and it was the most empowering moment of her life. When I ended the interview, I asked if she had any advice for the mothers making the same decision, to which she responded, be still, take control of the moment and rest. Be present and aware of the miracle that is taking place and listen to your intuition. Unless medically necessary, let your body do its job. Now that we've learned about the option to VBAC, let us learn about another similar option. This final option is a bit lesser known. This is the HBAC. According to an article I read written by an Ashley Marson, HBAC stands for home birth after cesarean. It is essentially a VBAC performed as a home birth. The article goes on to say that ACOG, the American College of Obstetricians and Gynecologists typically recommends that VBACs take place in a hospital setting. This article states that when compared to a hospital VBAC, HBAC poses higher risks of hemorrhaging, postpartum infection, uterine rupture, and NICU admission. I also had the pleasure of interviewing home birth midwife Jennifer Fry, CPM. Jennifer has been a midwife for 3 years now and serves Lancaster and York County Amish, with a small percentage of non-Amish clients. In addition to the previously stated benefits of a VBAC, Jennifer adds, the benefits of having an HBAC include the ability to labor and potentially deliver in your own space, freedom of movement, as well as access to food and drink. I asked her to give advice to a mother making this decision, and one of the things she said was, home birth should never be at any and all costs, and knowing when a VBAC or HBAC is no longer an option is important. Now that we've talked about the final option to HBAC, let us begin to close. Today we've discussed several options for birthing after cesarean: planned cesarean, TOLAC, emergency cesarean, VBAC, and finally HBAC. Hopefully after leaving today, we can all go on to educate our peers on birthing options after cesarean instead of perpetuating the misconception that once a cesarean, always a cesarean.